If you're listening to this, you're probably wondering whether non-surgical spinal decompression actually works. It's a question I hear constantly, and my answer is always yes, it does. And the results we see in the clinic, after 3 decades of practicing, still continue to amaze me. People come in worn down by pain, uncertainty, and the fear of surgery, and many leave with their lives transformed. Before I share some real stories, let me quickly explain what spinal compression is. It happens when things like herniated discs, bone spurs, or thickened ligaments put pressure on the spinal cord or nerves. That pressure leads to pain that shoots down the arms or legs, numbness, tingling, muscle weakness, and a loss of mobility that really affects quality of life. Non-surgical spinal decompression addresses that by gently stretching the spine and creating a vacuum-like effect that helps draw herniated or bulging disc material back into place, giving the body space to heal. By the way, what makes this therapy so remarkably effective isn't just the treatment method. It's the perfect alignment between the right patient, someone I would classify as an ideal candidate, and a highly knowledgeable practitioner whose mastery of spinal mechanics creates the foundation for exceptional outcomes. So now let me tell you about Sarah, a 45-year-old office worker with a severe herniated disc. She was in constant pain, couldn't sit, couldn't sleep, barely walked. 3 doctors told her surgery was the only way. She came to us as a last resort, and after just a couple of sessions on our computerized decompression table, the pain started easing. After a few more, she could sit comfortably again. By the time she completed the full course of treatment, her pain had dropped from a 10 to a 1. She went back to work, started exercising again, and completely avoided surgery. That was 2 years ago, and she's still pain-free. Then there's Robert, a 52-year-old carpenter with 2 bulging discs. He was on disability, couldn't work, and was sinking into depression. His surgeon had recommended a 2-level fusion, but his wife encouraged him to try decompression first. Within a few weeks, he was sleeping through the night. A few weeks after that, the numbness in his leg had almost disappeared. He finished treatment, returned to full-time carpentry, and told me he actually felt stronger than before his injury. He never needed surgery and got his life back. Margaret was 74 and suffering from neurogenic claudication, spinal narrowing that made walking painful and exhausting. She was relying more and more on a wheelchair and had given up on being active. We started her on a decompression protocol, and within 2 weeks, she could walk to the end of her driveway. A month later, she was walking around the block. After completing her program, she was walking over a mile daily and chasing her grandkids again. No more wheelchair. She still calls to tell us how grateful she is. Then there's Gina, a 34-year-old nurse. She came to us on heavy narcotics, unable to work, and considering disability. She had a herniated disc and degenerative disc disease, and 4 surgeons had told her spinal fusion was the only option. We started decompression therapy, and within a few weeks, her pain became manageable. By the end of her treatment, she was completely off medication and working 12-hour hospital shifts again. No surgery, no complications, just her life back. Now I want to be real with you. This isn't a miracle cure for every single person, but in my experience, about 80 to 90% of the right candidates see significant and sometimes lasting improvement. We're talking about conditions that used to mean surgery by default: herniated discs, bulging discs, sciatica, facet joint syndrome, even mild to moderate spinal stenosis. What makes this approach so powerful is that it's non-invasive, it's safe, and it doesn't close the door on surgery if you still need it later. But most people don't. Most patients start noticing changes in the first week, and by weeks 3 or 4, the improvement is undeniable. And the best part, these changes last because we're helping the body heal the actual problem, not just mask symptoms with drugs or cut things out surgically. So if you're struggling with back pain, sciatica, disc issues, or spinal stenosis, I strongly encourage you to explore this option. The results speak for themselves, and the peace of mind that comes from avoiding surgery, that's priceless.